Now it's time for tonight's View from Here, and we're heading to Yorkshire, where the country's chief veterinary officer has announced that the world's first case of bird flu in a sheep has been discovered. The exact location of the farm has not been disclosed, but a spokesperson said that the sheep in question had been humanely culled. I spoke earlier to Dr. Danny Chambers, who's a Lib Dem MP for Winchester and also himself a veterinary surgeon, and he told me what he made of this development.
Well, it's a very interesting development because it's the first time in the world that bird flu has been detected in sheep. So from a scientific point of view, it's very interesting. But it is worth pointing out that we know bird flu can infect other animals and mammals, including people. We know people have been infected with H5N1 from birds. There's currently cases of cattle being infected by H5N1 in the USA at the moment. So we're not completely surprised that a sheep could get infected, but it is very interesting that it's the first case that we've seen in the world.
And how concerned should we be about this? Because it does seem to be another indication that this virus can leap across species.
That is a concern, but this virus has always been able to leap across species. But what tends to happen is that if another species than a bird happens to get infected, they're not infectious to other animals. So when a person gets bird flu, they don't tend to pass it on to anyone else, even though they might get sick from it. Now, what we really worry about is the risk of the next pandemic, is that if a person gets infected with bird flu and they happen to be infected of human flu as well, those viruses that are infecting their cells at the same time could sort of mutate and mix, and that would cause a flu, a new type of flu that can spread between people. So this development here with the sheep isn't leading us any further on that line, but there's always a risk that there can be a mutation, which means bird flu can spread between people, and that's what we're worried about.
As we remember, 5 years since that first lockdown caused by COVID, I'm sure people listening might be a bit worried about this, but tell us about what happens when a case like this is discovered, because there's already a routine in place for if bird flu is found in poultry. And what happens if it's found in sheep?
Well, this single sheep was actually found in an udder infection. So there's a really common infection of sheep called mastitis. Humans and cattle get it as well, but it's common in sheep. And it had the signs of mastitis. So it was tested, and really unusually, it turned out to be caused by bird flu. So this sheep has been euthanized, and tests are being carried out by the Animal and Plant Health Agency, and they will be analysing the virus and seeing how it's changed from the normal one that infects birds. And that's what would happen in any case where an animal gets infected with bird flu that you wouldn't expect to get it, that they would have a post-mortem done, and we try and learn about it and see whether it is a risk that it might spread either between those animals, whether it will spread to humans.
We already have arrangements, don't we, whereby if a case of bird flu is discovered in a flock of poultry, then that whole farm, all the poultry have to be culled, don't they? I mean, there are quite strict regulations around this.
Yes, that's right. Bird flu is a notifiable disease in poultry, and that means that, a bit like if you get foot and mouth in livestock, it's a notifiable disease. And because it's such an infectious disease between poultry, so between birds, it spreads really, really easily. If one of them has got it, normally the entire flock on the same property will either have it or be at a very high risk of getting it, and also flocks in the surrounding area at a risk of getting it. And so at the moment, the policy is to cull when a case is found, the entire flock. But that's not the case in sheep at the moment. And the other sheep in that herd have been tested, and they haven't got bird flu. So it's been confirmed that it's not spreading between sheep. It was just that one sheep that had it.
I'm looking at figures from the Department for the Environment, Food and Rural Affairs that 1.78 million farmed and captive birds were culled between November and February. clearly for any farmers who are affected, I mean, this is a real nightmare, isn't it? Because they have to have their entire farm quarantined. Obviously, that stock have to be culled and can't be sold. And this at a time when we know how much pressure farmers are under.
It's a huge problem, both economically, it disrupts the business hugely, but it's also a welfare problem. And we shouldn't underestimate the mental health impact that has on farmers, because farmers spend their life caring for animals, and when they have to be culled because of a disease outbreak, which is completely out of their control, it can cause huge mental health issues, huge amount of stress. And there's a great organization called the Farm Community Network, which provides mental health support for farmers who are struggling with mental health issues and stress. And for a whole variety of reasons, farmers are struggling with stress at the moment, and this won't be helping.
Do you think the government's got the right response at the moment to this bird flu outbreak, or these series of outbreaks that we've seen in this country?
Well, while it is a notifiable disease, legally there's not any other option. And because it's such a virulent disease, it spreads so easily, it's one of the only ways of managing it. But one thing that we really have to make sure we do is invest heavily in research to understand the epidemiology, the spread of the disease better, so that we understand better how to prevent it, but also looking at options like vaccines that are effective, vaccines that allow the meat to still be sold into the food chain. And we all know that with humans, we have flu vaccines every year. You can only make your best guess at what type of flu it will be that year. It gives you some protection, but it doesn't mean you won't get sick at all. It's not a silver bullet. And flu is such a tricky disease to understand and vaccinate against. And it is one reason that we're worried about a potential bird flu pandemic, affecting humans, because it is really hard to vaccinate against flu. We did a great job with COVID. We quickly developed new vaccines that worked in a different way to the ones that we use against flu. Flu is still proving quite tricky.
So just finally then, is the government working on a specific vaccine against bird flu, or does it have to be just a general flu vaccine as far as humans are concerned?
It's probably a good time to talk about sort of geopolitics, actually, because we know that the USA are pulling out the World Health Organization. They're starting to stop the Center for Disease Control in the US from sharing their data with other countries. And actually, these problems are global problems, and we use some data from the US to decide every year which flu vaccines we need to vaccinate against in the autumn. And so already this stopping of communication between the US and the UK and the EU is going to affect how we decide what flu vaccines we vaccinate against. So these are global health problems, and they take global solutions using global data and a lot of cooperation between scientists and governments and research institutes around the world. And so it is something we're really worried about as people are becoming less cooperative when it comes to health.
Well, that was Dr. Danny Chambers, a Lib Dem MP for Winchester and a veterinary surgeon, speaking to me just a little earlier.